The question that I wanted to address at the core of our work is that how do we build trust in the healthcare system? In communities where trust may be lacking due to persistent quality issues, persecution, loss of faith in the system. How do we do that? And what is the role of innovation in that? We've been very, very fortunate to work with a number of partners across sort of the world and in the academia and the sort of nonprofit sector, the corporate sector, to really sort of help us think through that. Next slide, please. The journey, our journey, is driven by a passion and a belief that everyone has a right to an equitable healthcare and quality healthcare. It is a right for those who are rich and those who are poor, those who are citizens of a country and those who are stateless. As you see here, not far from where I grew up in Peshawar, these are Afghan refugees, people who have no agency, no financial or political agency, people whose identities have been taken away. Can we, while rejecting colonialism, do something meaningful through innovation? And we want to build trust. That takes time, that takes effort, and a lot of pain. Next slide, please. So some of the key things that we are very interested in is how do we sort of really develop technologies that can go into the field in some of these places that are hard to reach? And how do we sort of really do that in a sustainable manner? The path that we have taken is of discovery, and I would say self-discovery. The first lesson is learning from different disciplines. And here I do not just purely mean public health and biomedical engineering, I also mean social sciences and humanities, and trying to understand communities where we want to work. We also want to do that with a sense of humility, knowing what we do know and know reasonably well, and what we do not know, and engaging local partners that I think is absolutely important. And finally, focusing on the big picture in view at all times, that we are trying here to address the systemic issue of poor quality healthcare that is sort of rampant in many of these places because of colonialism, because of sort of lack of agency. And how do we sort of really change that? And innovation has a role to play. Next slide, please. One of the things that what I have learned, and I would say we have learned, is to think of people more than mere users of technology. Think of them in a holistic way, not just sort of users here. Think about their challenges and their financial capacity and their agency and the environment that they live in. Put humanity first, spend time in the community. We cannot do that in a way to just parachute in and parachute out. We really have to understand the community that we want to work in, develop a bond and relationship of trust. Design itself is more than a mere sum of quantitative metrics. Design also means making sure that it doesn't exclude people, that it is respectful, that it is ethical. And those things I think are absolutely important as we design new technologies. And finally, work across disciplinary boundaries. I've had the tremendous pleasure and honor of working across disciplines, working with professors in English and gender studies, anthropology and divinity school, public health and mathematics, trying to understand the problems and really sharing our solutions so that they not only are meeting the design criteria, but also are ethically grounded. Last slide, please. So where are we headed from them here? What we have learned is that the society as a whole needs tools that are fit for purpose for discovery, analysis, and impact. We cannot continue to use the same tools for newer problems. We have to innovate in that regard. And in that case, we have to engage with the community. We have to assume that healthcare is a right, not just a privilege. And by healthcare, I mean quality health services. Our interest is in improving the quality of medicines, but I think it goes beyond than that. Finally, some of the greatest challenges that we face, I think we need to think about those in the innovation landscape as well, in our technology development, in our classrooms, and the commercialization pathway that many of our colleagues have talked about. I think one of them is the greatest challenge of in sciences, that is about environment, and how would that impact access and increasing health inequity, including in urban centers and in rural areas. And finally, an area where we work quite a bit is people who are pushed out because of conflict and environment, one or the other, or working together, and are sort of forced to live in these refugee camps for decades at a time. Who's going to take care of them? And we've been very fortunate to work with scholars and practitioners, VCs and companies, industry partners, and federal agencies to think about this in a holistic way And I think BU has been a fantastic place in enabling us to do that. Thank you.